paper-based bureaucrat who goes home at 5 can't keep up with a crook who has a BlackBerry and a laptop and stays until later in the evening. Why do you believe that it's going to be cheaper? The only way it'll be cheaper is if they cheat somebody. Now, Medicaid in almost every state, I think frankly in every state, pays less than the market rate. So the way Medicaid looks cheaper is they just don't pay for it. So if the governor's proposal is that we cheat the hospitals and doctors of Missouri, that's an option, but it doesn't strike me, if you go talk to the doctors and the hospitals, that they'll think that's a very fair option.
What do you think of the cost of healthcare right now, and that, and maybe, I don't want to load the question, but if you do think it's higher, what do you do to take care of it?
Well, I think you've got to have a program that very dramatically shifts the structure of healthcare itself, which is very different than arguing over who pays for it. I think you have to move towards wellness, prevention, early testing. You have to move towards getting people to take care of themselves. So if you're diabetic, or you have arthritis, or you have asthma, or you have cardiovascular disease, you have to be actively engaged in managing yourself. I think you want to incentivize the system to migrate towards better practices at lower cost. We believe at the center that if you had the right policies, you take between 20 and 40% out of the cost of the health system. But you do that by being smart. You don't do that by adding a bureaucracy that can't possibly keep up with reality. The other point I'd make is we favor very strongly at the center that we have litigation reform. In Texas, there's a clear case study of places that had as much as a 95% drop in the cost of malpractice insurance. The Christus Health System in Texas is now building clinics to help the poor with the money they used to spend on malpractice insurance. And so there are things you can do, and Missouri's been a leader under Governor Blunt in the malpractice reform that's been very effective. We ought to do that nationally. I also believe that you ought to look at fundamental breakthroughs in research, such as Alzheimer's, that are worth investing in. And so we think at the Center for Health Transformation, there are a lot of steps you can take that are smart. But there's a huge difference between suggesting that establishing a federal bureaucracy to impose rules and to decide to underpay doctors and hospitals is a substitute. Finally, I would say we favor the right to buy insurance across state lines, so you'd have competition from all 50 states offering insurance policies across the country.